Hello, and welcome to Group 4's Bay Path University Healthcare, where we put the patient first, always. Our mission: to provide excellence in healthcare that is accessible to our community while educating our students to be committed to improving both the health and well being of people. We are dedicated to empowering quality, compassion, and service excellence in the delivery of healthcare services. Our vision: commit to training exceptional quality healthcare professionals to serve our communities. Provide timely access to a full range of healthcare services for all stages of life. Commit to a strong reputation for innovative care and discovering while maintaining continuous quality improvement. Commit to do the right thing every day to improve the health and well being to our communities through service excellence. Our core values: quality and excellence, community and collaboration, education and leadership, and caring and stewardship.
The first pillar in service excellence is growth. Bay Path University Healthcare receives patient satisfaction surveys quarterly. The most recent report to date show that the HCO's communication skills across all forms of care have started lacking, affecting their delivery of service across all departments. For this pillar, the performance improvement team was charged with proposing recommendations to improve all areas of service. They include a strong, consistent training program becomes the foundation for communication excellence, provides a basis for achieving standards of behavior and performance for employees throughout the entire healthcare organization. Implementation of system-wide standards of communication, education, and training. Consistent throughout the entire HCO, this strategy incorporates the standard practice of rounding on both patient and employee needs. Regular meetings between coworkers and with leadership as a means to understand and respond to what our patients and people want in their communication tools, resources, and best practices. We encourage the use of value stream mapping or following the patient HCO through the entire communication process from pre-visit to post-visit to find any areas of waste and eliminate them. This method locates the root causes of ineffective forms of communication practices, but also helps identify areas for improvement or innovations. This can include constructive feedback from coworkers to enhance communication. Annually review the communication programs and resources. Remain open to new ideas from the community, which are opportunities of improvement for relationship building and effective communication through data gathering and assessment. Remain consistent across all forms of messaging to deliver clear communication. This includes meetings, preference cards, print and electronic communication channels, website pages, and patient portals.
Bay Path University Healthcare Pillar of Excellence, Our People. The Performance Improvement Team dedicated 6 to 8 weeks collecting and analyzing data. During the analyze phase, utilizing Lean to Make methodology, the team determined the recognition and rewards program was essential in further cultivating a culture of service excellence and employee appreciation. The team determined the current program merely stalled due to failures at all levels. Individuals were not to blame, rather, the process needed to be updated, contemporized, branded, and reintroduced to the Bay Path Health community. The Performance Improvement Team further determined a successful program would require benchmarking as both a qualitative and quantitative process to help identify opportunities for improvement and to safeguard process improvement. The team was equally challenged to evaluate the financial impact of the program. Understanding the team's goal included reducing waste and cost while at the same time improving quality for both our patients and our employees. The team explored and included cost savings considerations. Our research revealed there may be less of a correlation between monetary rewards and an engaged, motivated, and satisfied employee. We discovered people prefer job satisfaction and immediate recognition. Simply put, our people respond well to being recognized and appreciated by their peers and leadership in a timely and consistent manner. The team therefore recommends maintaining and improving the current program by including frequent and timely employee recognition and appreciation opportunities and awards. Our recommendations align with Bay Path University Healthcare's mission, vision, and core values to strive for service excellence through the support and development of our people, continuous improvement, and a firm understanding and watchful eye on enterprise sustainability.
For the quality pillar, the SBAR approach, situation, background, assessment, recommendations, was taken to examine the issue. The situation was presented as there have been recent complaints about the quality of care, and leadership placed a mystery shopper on the surgical floor, and the report of the experience was less than expected. A performance improvement team next examined the background, reviewing information from complaints, gathering new survey information from patients and associates, reviewed protocols, and observed for adherence to standards. During assessments, findings from the mystery shopper experience informed actions to be undertaken in multiple departments to correct actions and empower associates. For recommendations, the PIT, Performance Improvement Team, suggested a 12-month implementation schedule, including service recovery plan, improving communications and patient handoff, using ADIT, acknowledge, introduce, duration, explanation, and thank you, and for the clinical side, the Comprehensive Unit-Based Safety Program, CUSP Toolkit. These actions are expected to make significant, observable quality improvements to patient experiences and drive service excellence.
6. 5 pillars service. The situation was presented to the advocacy representative. Patient wrote to the advocacy representative explaining how staff members at Bay Path University Healthcare failed to provide service excellence. The performance improvement team was assigned to develop a plan of action to address service failure. As part of the intervention, PIT had a meeting with the staff and providers who were in contact with the patient. After collecting all the information, the PIT realized there was an overall miscommunication with the patient's schedule, collection of insurance information, and lack of follow-up from the admission technician. The PIT recommendation was to develop and establish a service recovery program to address current problems and provide staff training to avoid future service failures. The PIT recommended a variety of service recovery techniques and trainings, including first and foremost to provide a rapid response to the incident presented to the advocacy representative, provide staff training on how to use keywords at key times and the aided approach to service, establish scheduling functional protocols to address the following areas: scheduling, patient check-in, patient handling, system gaps, technology, equipment, environment, and setting. Implementing actions of service recovery to address customer basic expectations. And as an opportunity for improvement, implement the complaint management process. The mission at Bay Path University Healthcare is to provide service excellence and putting the patient first always. By implementing these various service excellence recovery strategies and techniques, all staff members will be empowered to provide quality service to all patients and address any issues immediately.
For the pillar of finance, the issue was presented that patient statements have been returned to the office manager at Bay Path University Healthcare due to numerous errors in patients' demographics and their insurance information. Incorrect or incomplete patient and insurance information have incurred additional and excessive overtime expenses and loss of revenue for the department. Patient and employee satisfaction ratings are low due to inefficiencies in the process and the workflow. The Performance Improvement Team has proposed the following recommendation to address these financial problems. They include providing a mobile application for patients to schedule or request an urgent care appointment. This would include filling out an appointment request form requiring patient demographics, phone number, and insurance information. Mobile or electronic check-in to reduce patient wait time, significantly improving the accuracy of patient intake information. Provide self-service check-in for patients with real-time automated eligibility checks, real-time data verification, and point-of-service collections for both the family medicine office and urgent care center. This reduces the need for extra staff for patient check-in. Or provide patients with mobile tablets or computer kiosks to input their own required information. This manages patient volume, reduces wait time, and improves the accuracy in patient data collection. Schedule check-in staff to arrive 1 hour prior to first patient appointment so that they and the office are ready for patient intake. Ensure adequate staffing so that the office can handle patient volume. Include training of staff at check-in to be well-rounded in medical terminology, procedures, workflow, customer service, and organizational skills. Establish a registration protocol among all check-in staff that includes verifying patient information. Alternatives to review patient information include establishing a runner who brings patients from the waiting room to their exam room. They can reaffirm the patient's demographics in the process, and this can reduce wait times. Create a call center to handle all incoming calls to act as a central area for information. This increases accuracy and keeps information consistent. Implement a claim billing scrubber to reject any patient misinformation with the insurance carrier. This is to increase accuracy of patient information as well.
In conclusion, Group 4 Bay Path Healthcare University continuously strives to be a high reliability HCO through performance excellence. We are accountable to implement processes to build our workforce of people while maintaining quality care for our patients and upholding finances to support growth outcomes of our organization. BPHCU continues to challenge ourselves to provide equitable care and to improve the health needs of the patient communities we serve. Thank you.